After my back teeth had decayed, my friend recommended dental implants. The doctor said that immediate implantation is possible. A more advanced technology. It's really expensive. A tooth imported from abroad costs 9,800 yen. In all, it cost almost 20,000.
Recently, a friend complained to me that the dental implants made her so poor. After audio, I wondered why they could cost 20,000 yuan. I asked for dental implants like Asian seeing, all like this.
How much does it cost to have a tooth implanted?
2,000 yen to 3,000 yen.
Can I have immediate implant placement?
Sure.
Is 1,980 yen the cheapest price for dental implants?
Right.
How many years does your warranty cover?
We have a lifetime guarantee.
So, should I believe what the advertiser says? Today, we have invited an international renowned expert, a medical doctor from Taiwan, a dental implant doctor with a PhD in oral medicine from Fudan University, the director of Sino-Swiss United Dental Hospital, Dr. Huang.
Whether credible or not, we need to understand the principles first. The osteogenic period takes 3 months. Also does the synostosis period, and the tooth removal period takes half a month, which means it usually totally takes 6.5 months. What is the osteogenic period? After the extraction, waiting 3 months for the wound to heal. So if some people have already had their teeth extracted, the wound has been healing for a long time. You can skip the first step, but don't think missing teeth is a good thing.
Why is it no health benefits to be without teeth for a long time?
Long periods of missing teeth can cause atrophy of our alveolar bone. Instead, you need to undergo bone augmentation surgery. The combination of bone powder and implant bone takes more than 6 months. So some people in the first stage, it will take 6 months to 8 months. Can we skip the first stage? Installing an implant after tooth extraction depends on the treatment conditions.
What kind of person is suitable for immediate implant placement?
If you have oral inflammation, mucosal disease, bleeding disorders, high blood pressure, heart disease, diabetes, osteoporosis, etc., you can only do it after the condition has improved. And if you want to do immediate implant placement, except for the red line above, we also need to ensure that the alveolar bone, gums, and other teeth are in a healthy state. Then let's talk about the second stage, the synostosis stage. The purpose is to place an implant on the alveolar bone surface, to serve as a new tooth root. After 3 months, the new tooth root will grow firmly, and we can install a new crown on it.
Does dental implantation hurt?
The anesthetic is sufficient for dental implants, but there will definitely be a certain amount of pain after the surgery. If it is 10 points, this pain is normal and can be tolerated for 2 or 3 points. Everyone can tolerate, so please not scare yourself. In terms of price, brands that are centralized purchasing are preferred. Centralized purchasing means the state's centralized procurement from implant companies, domestic and foreign companies. The ultimate goal is to make prices more intimate. For example, domestically produced in South Korean products have already low prices, and the price reduction is not significant, just 700 to 800 yuan, such as those in Europe and America, will have a much larger range. For example, ITI of Switzerland.
ET is the International Society for Oral Implantology, and is partner with Straumann Ideographic Period. Together they promote research in the field of implantology. This is why many doctors used to call Straumann ET.
Like ITI, previously priced at 10,000 yen. Now it is 7,000 yen to 8,000 yen, which is a relative drop of 3,000. So most of the dental implants cost less than 10,000 yen. Some are as low as 1 to 2,000, but they are very rare. The clinical data is also scarce, and the requirements for patients are high.
C. For economical price, choose domestically produced in South Korean. Prices range from 4 to 7,000. If you want high-end, choose European and American brands. After centralized procurement, it only costs 7 to 8,000. 1 to 2,000 a piece at the low end. It does exist, but clinical data are scarce, so it is not recommended.
There are a few points to remind you that the anesthesia fee, the surgery fee and the collection are all unified, and are uniformly called the surgery service fee ideographic period, which is included in the implant price I have just mentioned, and cannot be added. Those under the banner of low prices charge extra for examinations, labor, etc. It is unreasonable. So what kind of contraction is reasonable? It is the bone surgery that we have just mentioned in the first stage. Bone powder, bone membranes or the use of immediate implant techniques. These additions are justified. The surgery is like drilling a hole. How deep it is and whether it is deflected or not, all depends on the skill. The surgeon has to conduct interviews and make plans, so the number of patients he can take in each day is very limited. The more experienced the implant surgeon, the more difficult it is to find a specialist.
Thank you so much, Dr. Huang. By the end of 2022, the total number of missing teeth in China was as high as 2,288 million. Calculated at 7,000 yuan per tooth, the market scale would reach 16 trillion yuan. However, there are less than 60,000 qualified implantologists, which is seriously insufficient. But with the digital visualization and 3D printing technology, a guiding model that fits inside the patient's mouth is made within 30 minutes. The angle and depth are set for you. In fact, in China, robots have assisted doctors to plant 6 teeth, and according to Tesla's latest release on robotic research, that day apparently even closer. If so, dental implants cost 1,000 to 2,000 yuan per tooth, would surely be available on the day when the ad becomes a reality. This is a CH Spotlight, introducing new products, seeking partners, searching for talents, raising investments, and going global. We will put you under the spotlight.